Male incontinence is a problem that we see typically after prostate surgery or pelvic surgery. After a radical prostatectomy, the rates of bothersome incontinence in the male are about 5 to 15%, depending on their particular situation.
I'm a prostate cancer survivor, and I had a radical prostatectomy. And basically, the key side effects of that is either incontinence and impotence, and I basically had both. So the initial issue was, after about 2 years of physical therapy, I wasn't able to rehab that area of my pelvic floor and was still, as Dr. Bryan Kansas would say, severely incontinent, and began to look at some options.
Bob's a gentleman that I met, actually I rounded on him after he had his radical prostatectomy here in Austin. He went home and he did pretty well from a prostate cancer perspective, but he had pretty significant erectile dysfunction and incontinence. I had him do pad weight tests, which I do with all my patients to see exactly how much they're leaking, and he did end up in the severe category. I like to figure out if patients have mild, moderate, or severe incontinence after a radical prostatectomy, because that way I can help choose what is right for them in their treatment. He was in the severe category. I ended up actually placing an inflatable penile prosthesis and an artificial urinary sphincter in him, and that's about 5 years ago, and he subsequently has done very, very well.
So the recovery process is about 6 weeks. Swelling has to go down, healing has to take place, and those kind of things. But it wasn't inordinately. It's nothing that ice and Motrin can't take care of, and it wasn't that difficult. And basically it's easy, very functional, easy to use, as long as you've got good dexterity in your hands and no one knows where it is. The reservoir's up in your pubic area, they can't see it. The little ball for the fluid is down there. You just push a little button and you urinate, and it automatically closes itself after about 60 seconds. So it's very easy to live with. I'm glad to be a patient of Dr. Kansas. I like him, and he's a good guy, and I'm just pleased to be able to say that publicly.